I think about healthcare and what it could be, and I'm tapping into your VP of a strategy here. Healthcare can really be different. We can keep people healthy. We can keep them out of the hospital. All these things get talked about every year at the JP Morgan conference. Data becomes an integral part, and these kinds of operational systems become an integral part. What could healthcare look like if we continue down this path with some of the things that we've talked about today?
Yeah, Bill, Intermountain, we began this journey really 10 years ago about doubling down, saying, okay, we've got to transform healthcare. It's way too costly. We're treating illness rather than understanding how do we keep people well and how do we keep them out of our hospitals. And we doubled down on that. We really accelerated that when Dr. Mark Harrison came, the CEO, and we realized the traditional legacy business of healthcare, which is treating people within hospitals, needed to be disrupted. And either we were going to be driving that disruption or it was going to happen to us. Oh, and probably more important than that is doing the right thing for the right patients where we should be focused. So what we realized, though, is that causing that disruption within the context of a 23-bed hospital system wasn't going to happen. We were sort of running into each other. And so we restructured the organization into two different divisions. One was our community-based care division, which their charge really is how do we keep people well and out of the hospitals? And then our specialty-based care group, where when people do need care, how do we provide it in the most convenient, least restrictive, least costly space possible? So with that separate business where, to some extent, we take this seriously to say, what we need you to think about every day is how do you put our hospitals out of business, right? In the best possible scenario for us, it's that we never need another hospital again, because that means people are healthy, they're not getting sick, they don't need that higher level of care. What that did in sort of creating a very clear sort of separate component of our business where we could say, we're going to align the financial model right, we're going to align the incentives in the right way, we're going to allow people to innovate very quickly on how do we keep people well. We've seen a massive transformation around just moving from the traditional healthcare environment. So if you think about where healthcare is headed and where Intermountain is trying to be out in front of that is how do we leverage digital and virtual tools to meet people where they are and provide all of the care possible in a virtual digital environment, right? How do we make it so that people don't even have to leave their home for most of healthcare, or if they're on the go, they can get their healthcare by the phone. So we've made huge investments in our digital front door, which really is all things that you need in order to be able to interact with the healthcare environment. If you do need care, if you do need to go somewhere in bricks and mortar, we're making massive investments in care delivery models that are actually outside of the hospital, right? In an ambulatory setting, so that if I do need in-person care, it's super convenient, it's low cost. And then we're beginning to look at, okay, what do the hospitals of the future need to look like? And the answer is they look very different than what they look like today, because so much of what is done within the walls of a very expensive hospital today, you actually can do in a different way. And even the traditional hospital interaction, we have a hospital at home business. There's lots of other groups that are moving towards hospital at home. We're finding the opportunity for patients who are traditionally inpatient acute, we can actually care for them very effectively in their home in a home-based setting. So what we hope healthcare looks like in the future is you have a level of convenience and service that you expect from Amazon or any of the other USAA or any of these other companies that are known for a seamless, extremely convenient, high quality experience.